So it's been a while since I've given an update on my prostate cancer journey, and that's because there hasn't been anything really to say about it until recently. So to give you the backstory, back in May of 2024, I went to go see my primary provider for just a routine check. I think it was a follow-up from my use of Zepbound, my GLP-1 medication. And as a result of that, she wanted some blood work just to make sure that the medication, that everything on my blood work panel was good in relation to the medication. And as an afterthought, she threw in a test for prostate. This was a PSA blood test, so I didn't think anything of it at the time. Just thought it would just come back okay. And the numbers came back elevated. Don't remember the exact number, but I think it was 7.4. Now, she wanted to do another follow-up blood test in about 6 months, but from what I was reading, I wanted to get to the bottom of it right now. So I referred myself to a urologist. The urologist looked at my PSA test and then ordered some additional tests, a test called an ISO-PSA, ordered a MRI with contrast. Then once those tests came back and they didn't look too well, she ordered a biopsy. So I got the biopsy done, and the biopsy came back and showed that of the 12 cores that they took, 10 of them were cancerous. So at that point, they wanted to do what's called a PSMA test, which is a specialized imaging test to make sure that that the cancer hadn't spread to anywhere outside of the prostate, so like for the bones or to other organs, for example, and that came back good. So for a while, I was just deciding on a mode of treatment. It was either going to be surgery or I was going to have, because I was told active surveillance wasn't an option for me because of the amount of cancer that was present. Thankfully, the genetic testing showed that it wasn't an aggressive form. It was slow growing. The issue that was at hand is that there was just so much of it. It was completely covering my prostate, which made it more likely that it would jump and metastasize into my bones or some other vital organs. So with the course of treatment, for the radiation treatment, it's 9 weeks of treatment, 5 days a week. And I couldn't start it in December because I had a trip planned for 2 weeks. My grandson had a due date and we were going to be up there for the birth. So I had to put the treatment on hold because I couldn't interrupt the treatment and then restart it. So going through the process now of actually starting the treatment, I had my first appointment to prepare for the actual radiation treatment. I went in yesterday and had 2 markers placed into the prostate, and along with some gel that they place in between the prostate and the rectum to prevent any burning from the radiation onto the rectal wall, which could cause some complications, of course, that you don't want. Let me tell you, this was not a very good experience. It was very intrusive and very painful. When I met with the doctor initially, he gave me the option to do laughing gas and told me that since I had done the biopsy, it would be very similar, and if I didn't have laughing gas through that and I made it through okay, then I probably wouldn't need it with this. So at that point, I decided to forego it because it was an additional $100 charge. And then I got a call from the office manager the day before my appointment telling me that the doctor would be in surgery ahead of my appointment in the morning, and that I could show up probably about 15 or 20 minutes late because of that. And she offered me again laughing gas, and she told me that 95% of the men usually get it. So I said, what the hell? And I went ahead and got it. More on that later. So I get into the room for the procedure, and there's stirrups in there. They're attached to the bed. So women, I don't know how you guys do it. It's very intrusive, very painful as they stick the instruments into your rectum, because they have to insert the markers through the rectal wall and insert the gel through the rectal wall. So they insert an instrument to your rectum, and then they insert other instruments in order to place the markers and the gel within there. Prior to that, there was injections in order to numb the area, and the injections hurt, at least going in, and very uncomfortable, very, very uncomfortable. Oh, also prior to the procedure, they tape your manhood down to your body, these very adhesive tapes, and when they peel it off, that shit hurts. But anyway, back to the laughing gas. So they give me the tube for the laughing gas, then start the procedure, and I'm thinking that waiting for the stuff to kick in. I'm wondering if it actually kicked in, if it has taken the edge off and I'm not feeling the full effect of the pain, even though it's very painful. When he's almost done with the procedure, the room starts spinning. So then I realized the laughing gas has finally kicked in and he's done with the procedure. The only thing he had to do at this point was to insert the gel in between the rectal wall and the prostate. So I essentially wasted $100 because I felt the full effect of the procedure from get-go. But other than that, it's just something that you have to go through in order to get to the point of treatment. So next week I have another appointment where I will go in and they will do a practice run for the radiation treatment. They will give me 2 tattoos on my stomach wherever they're going to mark where they're going to aim the beam at, and that will also assist with the markers that they inserted into the prostate. They'll line up the CT scan and set the things to my body setting or my body size and go from there. So haven't actually got a start date for the treatment, but I'm assuming that it will start the week after I go through the practice run. So at that point, it's going to be 9 weeks of treatment, 5 days a week. So a total of 45 treatments. And tell me that I should be able to show up and return to work, but I should expect some fatigue as the treatment goes on and continues. The more I get, the more fatigue I would probably feel. I know some people have experienced some vomiting and diarrhea in the course of the treatment, but everyone's going to act differently. Hopefully that's not side effects that I get because you are aiming radiation into your body to eradicate these cancer cells. So that's where everything stands right now. So once I start treatment, I'll let you know how it goes. So keep me in your prayers. And for any man out there who hasn't had a PSA test, please go ask your doctor for the test so you can get your blood work done. If you have a family history of prostate cancer, you need to start at the age of 45 getting your PSA blood work done, so you can establish a baseline. And if you're a black male, you need to get it done because you are more likely to get prostate cancer than any other ethnic group. So don't put this off. Get out there and get it done. Talk to you later.